Perfect. On the administrative side, a couple people mentioned they didn't know, they didn't feel like they weren't getting to participate as much as they wanted. So I'm gonna then ask people who want to participate to raise your hand, so you know you'll get called on. And we can also use the chat function for participation. So if you have a comment or a question, just either raise your hand or just speak up, which is what we've done in the past, or put it into the chat function. So that way everybody can participate in whatever way they feel most comfortable. So raise hand, speak up, or throw it into the chat function. I've got the participants list up, and I've got the chat function on the bottom of my screen, so I can see all that. Let's see what else we've got here. That's about it. Oh, if you want to go over your paper again, feel free to schedule a Zoom session and say, you know, where you're at, what you want to do, if you want to talk about an outline, whatever. But I'm just here to be a resource for you. If you don't need the help, that's great too, whatever works for you. I sent out just an announcement basically on overdue assignments. I still have assignments dating back to week 2 that haven't been completed by some of you guys. So I'd rather not be a nag. It's really easy for you, and it's outlined in the announcement how you can check whether you've got an outstanding overdue assignment. And just please submit those, because, you know, sending out individual emails to everybody who hasn't submitted one just seems like I'm picking on people, which I'm not. So I just haven't gotten your assignments, and it's easy for you to figure out which ones are due. So that's all great. Anything else that we should chat about or go over? Great. I'm now checking raise hands. I'm checking for chat. So nothing, and again, don't hesitate to do that at any point. So why don't we go through, and again, if you want to raise hands, that's fine. If you want to put it into chat, our usual routine of you know, current topics in Kaiser Health that caught your eye, and you know, quick update on your paper, any sort of new, you know, research that you've gotten that was interesting to you, or that you found out this week that you didn't know last week. You can raise hands, you can speak up, you can put it into chat, whatever you want. Everybody's welcome to do it, since we're going to go through the class anyway. There we go. Amisa, please. You can't hear me? You can hear me, right? No, you can't. Can you hear me? You can hear me. Oh, I can't hear you, Amisa. Do I have you muted? I'm clicking on ask to unmute. Is that
okay? There we go. There, I wasn't able to.
There you go.
Yeah,
I see your microphone going up and down, but I don't hear anything. Does anybody hear anything?
Or you guys can hear me now,
how
right?
come I'm not hearing you? That's strange.
What the?
This is going to be a tough class. Can anybody else speak up just so I can hear if I'm not getting? Oh, hang on. Let me check my speaker. Maybe on the wrong speaker. Yeah, there's the problem. Okay, try that again. My bad. Participants are not allowed to unmute. Okay, well, now remember, this is a new computer, so we're going through.
Can you hear me, Nick?
I can hear you now.
Okay, well, I think for everyone else, but for that issue in the beginning is that I wasn't able to unmute because it said like locked it.
Okay. Sorry about that, my bad.
No, you're okay. So what I found interesting in Kaiser Health this week was kind of like an outline on how New York City, or just New York State, is leading in like abortion access. And like I read in the article from Kaiser Health that like New York wasn't requiring a residency, didn't have a residency requirement for abortion. So like you didn't have to live in the state to get that, to have that service provided to you, which is really nice, especially compared to like other counterparts like Texas, where they're like very strict and even like reducing abortion rights and even transgender rights. Like they're just a lot more conservative than New York. And I don't know, I just found it interesting, especially because like, I mean, I voted for my governor, Hochul, Catherine Hochul, and she's just very, I mean, I feel included, and I feel like this health, like New York health is kind of like leading the way in abortion access. So I feel good about my state, and that's kind of what I found for Kaiser Health this week. Um,
Yeah, I saw that this morning too. I thought it was interesting. And I was actually surprised I was surprised that states would have residency requirements to have a medical procedure. You can go anywhere
yeah,
in the country to have any medical procedure you want. Has anybody else ever heard of residency requirements to have a medical procedure? Yeah, that's what surprised me. I thought, because Massachusetts and New York are similar in that regard, in terms of being very, progressive and pro-choice and pro-women's rights. So yeah, I thought that was really surprising.
yeah. In terms of my paper, I kind of found like I've kind of been trying dig in on the 13th Amendment, because a lot of it is like the 13th Amendment kind of, it protects people from slavery. And so my topic is incarcerated, the exploitation of incarcerated workers. So like that policy or that law is directly aligning with my topic. And I kind of just, I don't know, I am like trying to understand, because the laws are really difficult for me to understand, because they're like in like that very special wording, and sometimes they don't really tell you how expansive they are and what they actually are doing. Like we know that the 13th Amendment protects people from slavery, and like and like we know that, but there are also like different parts of that amendment that I'm still looking into. Um, and was that it?
Sounds good. So
Okay.
yeah, I'm happy to, unravel legalese, because it is a whole separate language. So you can schedule time with me on a Zoom if you want, or email me questions, whatever you want. Again, not a topic I know a lot about, but happy to educate myself, and looking forward to you educating me, and the class. There's no requirement to work. You can opt out, I assume, of working as a prisoner, correct? Or is that not correct?
I found that like you're incorrect. Like you can't once once you were imprisoned, or once you were convicted of a crime, that state or that wherever prison that you're connected to, that they basically like require you to work. Like you can't
Wow.
unionize. Yeah, you can't unionize. You can't really. It's not really an opt-in or opt-out. There is no. You have
Opt out.
no choice.
So if
Yeah.
they say you're going to stamp license plates, you have to go in and stamp license plates.
Right.
Wow. See that I think that makes a very cogent. I mean, again, I don't know that, but I think that really makes a very cogent, I've never heard it before, argument for the 13th Amendment, because you're literally, it's forced labor. So, and you have no choice, because they compel it. Anyway, really interesting. Looking forward to hearing more.
Thank you.
It's funny, because when I clicked on participants are not allowed to unmute, it said I had allowed you to unmute. So anyway, it seems like we solved the problem. Anybody else, either speak up, raise your hand. Oh, one new message. Good. Now I can see. Still can't unmute. I'm going to click it on and off. Ask all to unmute. Mute participants upon. Allow participants. Hang on. Okay, you know what? It was checked and then unchecked. This should fix the problem. Can you unmute now?
Yep.
Yeah, sorry about that. Again, new computer. My old computer got glitchy and bloggy, so I had to like download all my software again and Microsoft Word. So my apologies. So we should be good from here on in.
I can talk about what I found now.
Great.
So on Kaiser Health, I found an NHPR article talking about how New Hampshire's are New Hampshire is illegally commandeering hospital resources by boarding psychiatric patients in ERs. which is now like a federal judge ruled that because like they're taking away like resources that are vital for other patient care just to house psych patients until they can go to other facilities. And in one New Hampshire hospital on Friday, there are 8 children and 38 adults that needed that were waiting for emergency mental health beds at different facilities that were staying in the ER because they didn't have a space. So they're now like not allowing that to happen anymore.
So I don't know, I'll be curious. So they're not allowing it, which means where do these people, they send these people who need beds back home? Where do they send them?
I don't
Or do they
think,
require them to become inpatients in the general medical wards?
I think that that might be a possibility. They didn't really go into like detail about where they're going to like place the patients until they get the emergency mental health like
Yeah, I mean,
bed,
that's the
but
$1 million question, yeah.
it yeah, they didn't really talk about that, which is like that they need to consider that, which is crazy. And then for my paper, I'm just kind of like organizing all of the information that I found and like kind of creating an outline so that I can like figure out what information I want to go where and everything, and that like looking more in depth in the article that you sent me and everything.
Great.
Yep.
Yep, if you need any help or you want to send me an outline or anything I can do to facilitate, writing it and getting it done, I'm happy to do whatever I can. So
Thank
that's
you.
great. Yeah, this problem of boarding especially has been like, and in the ERs has been a disaster in the pediatric population, especially. So they've been talking about this nationwide. When I was at the last AME meeting I went to, they were talking about the fact that, there were just thousands nationwide of kids being boarded in pediatric emergency rooms or emergency rooms of all sorts. The problem is, what's the solution? There are no beds, there are no inpatient facilities. So I don't know what the solution is, other than, reimbursement for those kinds of hospitalizations is paltry. So hospitals don't want to build more psychiatric beds, and there aren't psychiatrists or physicians or caregivers available to take care of them. So it's really, it's just a crisis in mental health. So that's great. Thanks. Again, feel free to, oh, hang on, I gotta switch between these. Oh, here, pop out. I was dying to figure this out. I couldn't figure out how to get the participants to pop out. Now I've got the chat on one side. Okay, so yeah, so now I'm looking at all the participants. If you want to raise your hand, or if you want to go into the chat, or you can just speak up, whatever you want.
I can go if you want.
Yeah, great.
For the Kaiser Health News, I was on like Instagram. I'm looking into like the Washington Post and their how like teenage girls are more depressed than they usually than they were like 10 years ago, I guess. And because of social media is having a huge impact on that. That's been interesting me, and I keep seeing more articles about it. And then for my paper, I'm reading an article right now. It's still pulled up. It's about like how like a lot of the healthcare for children, they can get the issues they're having in adulthood could have been cured when they were still children, but since they didn't have the access to it because of their insurance and all those issues, there's like this whole like, I don't know, they're trying to fix it and have more like behavioral health care, which is still a thing right now, but it's not as, you don't see it as often in pediatrics as you see it in adults. So just like, I don't know, I've been looking into that because it just interests me.
Sure, no, that's great. We talked briefly about the 60% increase in childhood and adolescent depression last week, and it's been front and center in the news, including that I think I remember seeing that. I think the article is actually interesting, or when I dove into it a little deeper, they were saying that a lot of these increases in childhood depression and anxiety and difficulties, behavioral health issues, predates both COVID and lockdowns and absence of school. So there a lot of it is, I think, really being attributed to social media, but it's a fascinating topic, and I have no idea how we're going to address it. But
Yeah.
last week we talked about that poor 14-year-old who killed herself, beat up in school, filmed, distributed, and then committed suicide. Terrible, terrible situation. Anyway, Anybody else? We'll get through the whole class, so whenever you want to.
I can go.
Great.
So for my paper, I also created like an outline and just kind of put like bullets so that when I go to write it, I can just put like paragraphs in for like the information that I want.
Perfect.
And then I was reading the Kaiser News this morning, and I read an article about health providers offering free care to people that were affected by the Ohio train accident. And so they offer like healthcare supplements and wellness services for free for all the people that were impacted by the train incident. So that was really nice.
Yeah, no, I read the article and remember they were offering telemedicine services because obviously they can't open offices, but I think the vast majority of these things can be triaged through telemedicine. And if it's something significant through the telemedicine, I'm sure they can direct them to more local. But they did, I think my understanding is that the federal government opened some kind of a clinic there as well, didn't they? That was my memory reading it, that they've opened some kind of clinic to address local things. Did anybody else read that? Anyway, I can double check that. But anyway, I definitely saw the one this morning on telemedicine that they were offering free telemedicine services, which is phenomenal. So that's great. Okay, thanks. Anybody else who hasn't spoken, or again, you can put something in the chat or you can raise your hand either way. Are you guys able to raise hands? Did I screw that up too?
I can go now.
Oh, great. Thanks, sir.
I like the article on Colorado capping the insulin prices there and going to EpiPens next. I think that's a good idea. I don't know why everybody wouldn't try for it. And then my paper, I was looking into a resource that goes by NADAC. So they were just doing research that I was looking at.
Okay, great. And again, anybody who wants to schedule some time or wants to send me an outline or whatever, anything I can do to be helpful to make this all happen is great. And yeah, on the capping, I mean, capping prices on I think there is some real clear wisdom on insulin and EpiPens. I remember reading something either today or yesterday on that EpiPens that are called EpiPens are like $400 and $500, but generic EpiPens are like $140. So yeah, there's no secret to it. And I think for critical medications like that are literally life-saving, there needs to be more intervention, because clearly the market has failed the community of people with severe anaphylactic allergic reactions and those with who rely on insulin to keep their blood sugars in check. So great, thanks. Anybody else? Again, chat, participant, raise hand or speak
I
up.
can go.
Great, thank you.
So a topic on Kaiser that I saw that was interesting was that they're trying to find dementia care trainings to be more like out and available, which I think is so important if like you're like not really wanting like your loved one to go to like a facility and you believe that they like want to try to give them their care before it's to the point that they can't do it anymore. I think it'd be very beneficial, especially as like a healthcare worker who works with dementia patients all the time.
Yeah, no, I agree with you. I mean, it's just, there's a whole spectrum of care that's needed, some of which is minimal and some of which is like essentially comprehensive. I mean, 24/7 type of oversight and management. But I think early on, it's sort of the they go from various forms of assisted living where they provide maybe one meal a day to with frequent check-ins, to live-in help with frequent check-ins, to ongoing. But I mean, even if you have a mild form of dementia, it can be lethal in the sense of people taking their medication 7 times a day because they forgot they took it 3 hours ago, or leaving the burner on or their oven on and not remembering that they left it on. So I mean, when it gets to that kind of, even though it might be a relatively, otherwise they're able to sort of cook food and dress themselves and bathe themselves, just that little bit of inattentiveness can end up with lethal consequences. I mean, there's a lot of pill popping little devices so that you can, they package the pills individually. So once it's been taken, and it's got the date on it and what dose you need. But it's a real problem, and it's going to be a much bigger problem as people my age and my generation age out, and dementia just keeps increasing and increasing. So yeah, definitely a needy topic, an important topic. Yeah. And your paper, I'm sorry again.
So my paper is on patient safety and neurosurgery,
Oh, cool.
and I found this article from the University of California, San Francisco Hospital about their improvement in quality program and patient safety. And I just took some notes with that because I thought just all of that was extremely important information, and that at least, and this is specific for their neuro department too, which is I believe huge, that hospitals are now implementing all these strategies for this to prevent wrong site surgeries.
Yeah, I'm always a big fan of best practices. If you can find a place that's doing it better than anywhere else, and you can communicate that to the rest of the marketplace and the rest of the departments and hospitals, that's extremely valuable. So I'm a big fan of guidelines, best practices, and evidence-based research that indicates how we can both upstream and downstream correct problems. And if you can come up with solutions that are both upstream and downstream, that's great. But some of your topics don't lend themselves to that. So downstream is just fine. Great, thanks.
Yeah. And then I just had a quick question. So I know one of the neurosurgeons at Brigham and Women's, and I was just wondering for wise of your input, if you think it'd be beneficial if I did an interview with him for my paper and see what their quality improvement practices are with their patient safety programs, if they even have one, because I'm
Yeah,
not
sure.
100% sure if Brigham does have one or not.
Yeah, I can guarantee you they have something. I worked there for 10 years. Yeah, I think it's always great. I love, interviews and citing an interview or a meeting, I think is great. I've suggested it to other people in the class as well. It just gives you a real world sense of what's going on. And, you might say, well, I've read they're doing this there and this there. Does that seem like a good idea or not a good idea? These are not 100%, even though they're never events, they're not 100% avoidable, but you can certainly put things in place. So yeah, I would strongly advise you, if you find somebody who's written on the topic, if they're willing to give you, even just exchange a few emails, if they don't have 5 minutes of time to chat with you, I think it's just extremely valuable, and it just enhances your own network. So I always am happy. I get, I would say probably 5 to 10 every year from people who are interested in getting an MD and a JD, and they want my opinion on whether it's a good idea or not. And I'm always flattered that they ask, and I enjoy mentoring, and most people do enjoy mentoring. And obviously, to those who don't, they're going to say I'm too busy. And if you can find somebody else, great. If you can't find anybody, that's also fine, not a problem. So I think it's always fun. I'm kind of social anyway, so that's great. Anybody else who hasn't spoken?
I can go.
Great.
So for the news, I found that San Francisco is trying to create a court for severely mentally ill people, and they're wondering if it'll work. This is something different. If it will benefit those individuals, make it more fair, I guess. And for my topic, in May of 2022, there was 43% of the formula products were out of stock nationwide, but usually it's, where'd it go? Between 2 and 8%. So I thought that was a really big increase. And then I did actually look at the Chat GPT, but it didn't work for me because it doesn't do information after 2021, and because of the timing of the baby formula thing, it didn't work for me, and it didn't even work pulling up baby formula, so that didn't work for me.
So yeah, thanks for trying it. So I wanted to try it yesterday, and I didn't realize you had to register. I tried it originally, but you have to register. Now it's getting used so much. There's a backlog, so I'm on some kind of a wait list to use it. But for those who are interested, Bing as a search engine uses a artificial intelligence network. And you're allowed 6 searches on that. So, and I haven't tried that yet. So that's another option for you. If ChatGPT doesn't work for you, try Bing. There are some really astonishing AI results. The New York Times had an article on a reporter that ChatGPT told him that he loved, that the ChatGPT loved the person and told him he had an unhappy marriage and that he should consider a divorce. And it was, and when he, the New York Times reporter approached ChatGPT and said, "What is going on here?" They went, "Oh, we have no idea." So anyway, there's a bunch of comical stuff. There's a bunch of comedians who jumped on board. If I'm trying to remember who it was, I sent it to my family members because it was very entertaining, but it was also beyond shocking, some of the results from AI. And AI is only as good as the program that created it and the inputs it gets. So we will find over the course of the next few years how good it is in some areas and how bad it is in others. So that's great. Yeah, and the formula thing, I agree with you. I think I sent you some stuff about, and so I hope you find it useful. If you don't, I won't send you any more. But I think, you know, there's a strong argument to be made that how is formula any different than insulin or EpiPens? It's food. You can't live without food. And you know, how maybe we should treat critical foods no differently than critical medication. So yeah, I'm looking forward to hearing your presentation and getting your paper. Who else is there to go? Where have we think we did everybody, didn't we? Oh,
I can
no.
go.
Oh, Keisha, go for it.
Sorry if you can't hear me. My voice is still a little out of whack.
No problem. It's easy to understand.
So, on Kaiser, I thought that the article on POTS patients was interesting.
What's POTS for those people who don't know what it is?
Postural orthostatic tachycardia syndrome.
Correct. Yep.
Okay. So, I have a similar diagnosis to that, and I have a friend that has POTS. And when I was reading this article and seeing that there are so few specialists in the condition, and that the waiting lists are so long, it made perfect sense. But I'm also like fascinated on why it's so hard to diagnose, and on you know, and on the like provider skepticism to an extent on it, and then also
Not to an extent, like massively.
yeah, well, I didn't want to be too harsh.
But I
but
wear the MD. I'm happy to be harsh.
and then why there's such an increase after COVID. What is it about COVID is it a causation, or is it just that people didn't seek care for their symptoms for so long and now there's just a backlog? And I don't know, I'm just fascinated with the whole the whole issue. You know, how do we treat something that a lot of providers don't believe is real, and there are so few people that actually specialize in?
Yeah, that's one of the disadvantages of getting a disease or condition or a set of symptoms that doctors aren't that knowledgeable about, because the first conclusion they come is, you know, there's nothing wrong with you. It's all in your head. So that's a very frequent situation where doctors are unaware of a particular condition. So yeah, a lot of times these people get labeled as malingerers, or, you know, trying to manipulate the system or get disability. It's really awful. And as I've said, you know, I think a lot of this, and you asked the right question, is there really the analogy I'll give you, and maybe some of you are aware of it. There's been a dramatic increase in the number of diagnoses of autism and autism spectrum. What have a lot of people invoked as the reason for that?
Just being more aware of, you know, the symptoms and the
Exactly. They've changed the definition widely and have included, you know, very mild to really profound. The profound ones were never that difficult because the symptoms were so obvious, but the subtle ones were never appreciated. So is there really an increase, or have we just changed our measure? And that was your question as well on POTS. So yeah, it always question when you read stuff. I mean, so much out there is just completely bogus or not valid. So I just can't. Like, I'll just give you a perfect example of this because it just happened recently. Did anybody hear about the fact that the comprehensive study showed that masks do nothing? So it got a lot of press in the past 2 weeks, and from what's the Cochrane group. Did we talk about this last week? No. So the Cochrane group is actually very reputable. They do meta-analysis, and they did a meta-analysis of like 68 studies. And they said, we've done a meta-analysis and compared them, and masks don't work. Of course, if you actually drill down, and they're normally extremely reliable, if you drill down, 62 of them didn't involve COVID. As a matter of fact, only were for influenza, and only 2 of them involved COVID itself, were contemporaneous. So what's the big meta-analysis if you've only looked at 2 studies that involve COVID? And there's been tons of other research subsequently. So they have very strict criteria, and there were at least a half a dozen, if not probably 20 or 30, I haven't looked at comprehensively, rebuttals to this Cochrane because they're so well known and considered reliable. But people like Marjorie Taylor Greene and the other people who are just say on one extreme of the political spectrum, were jumping all over it, including a New York Times person who wrote an article on it. And if anybody's interested, I can send you the articles that rebut it quite effectively. As a matter of fact, when the first time I read it, I emailed one of my guru friends in infectious disease, and he said, don't believe it. Masks do work. As a matter of fact, they concluded that hand washing doesn't work. So, because in their meta-analysis, so it just tells you how, you really need, every time you hear something, no matter where the source, question it. I mean, remember, Anthony Fauci said, don't wear a mask for the first 3 months of COVID. Does anybody remember why?
Because it would spread fear, wasn't it, or something like that?
That was one of them, but there was actually a more pressing reason. How available were masks early on? He was afraid, and that the healthcare workers wouldn't be able, there'd be a mad rush to get all the N95 masks, and there would be none available for healthcare workers. And that was a major concern. And then slowly they started saying, use a bandana, use anything. I mean, it got really ridiculous. Instead of just being transparent and saying, look, once we get supply chain set up, everybody should be able to get them, but we should wear them. So anyway, just an interesting thing. Let's see what time it's 12:40. Well, let's just go through these questions then. And I wrote some extra questions, but let's go through. So 3 through 7, so there's a total of 5 questions. What was learned about non-pharmaceutical interventions? And the easiest way, to be honest with you, the materials I provide should give you the answers to all these questions. So if you read the questions first, then read the materials, it just makes it a lot easier because you can point out, oh, that's the answer to 3, that's the answer to 6, that's the answer. So does anybody want to give me an example of a non-pharmaceutical intervention? Again, either through chat or raising your hand or speaking up. Is a vaccine a non-pharmacologic intervention? No, it is definitely a pharmacologic intervention. Are steroids a non-pharmacologic intervention? No, because it's a pharmacology, it's a drug. Is contact tracing a non-pharmacologic intervention? Correct. So you guys get it. Bottom line is that masks are non-pharmacologic, social distancing is non-pharmacologic, contact tracing is non-pharmacologic, testing is non-pharmacologic. So those are, and what was learned about non-pharmacologic interventions in retrospect? Do they work? Don't they work? Which is the answer to the next question as well, which is, what was learned about public adoption of social distancing, masks, and vaccination? Joe, I'm just curious, Amy,
I think people are like slow to adapt to, I guess, such big changes that they've never like not never seen before, but kind of the same thing of like, wearing a mask and being stuck in your house for 2 weeks. So I think it was like a slow adaptation and you're not really like sure of it, I guess, if that's like the right or what you were looking for.
yeah, no, that's exactly what I was looking for. And was it a political, was it a public health issue? Was it, hang on just 1 second, I apologize. Was it political? Was it, on partisan lines? Was it, political lines? What was going on, did you think?
I think it was partly political. Because a lot of the like politicians would say something and their parties would believe what they said. Sorry. And then other parties would say like, "Oh, get vaccinated," and then that party would get vaccinated. It was a whole like mess. I saw it within my family too. It was like kind of weird.
Oh, yeah. Yeah. So is anybody in the class, and I'm not trying to vilify or point anything out, but because there's definitely very strong feelings about this. So does anybody believe that either a mask or social distancing or vaccination infringes on your personal freedoms? There's a very strong minority of people who do. And when I say strong minority, probably 20 to 30% of the population, 1 in 3 people, if you go out there. I have people I've socialized with who, firmly will never get vaccinated. The vaccine hesitancy, does anybody remember where it first really appeared? What was the situation with vaccines that was raised as a possibility and was subsequently debunked that caused a lot of controversy on vaccines? And Robert Kennedy is like totally anti-vax, but Lancet actually published an article about vaccines, MMR, and an association. And it was actually mentioned at one of the last presidential debates during the primary. Anybody remember this at all?
You mean causing autism?
Correct. Yeah. So that's exactly right, Keisha. So, and it was brought up, I think, by the neurosurgeon who was running for pediatric neurosurgeon who was running for office. And like the medical community was like, this guy's bringing this up. It's been completely, totally debunked as being totally spurious. And the person, the Lancet withdrew the article. The person was then, really marginalized, which I don't think should have happened. I mean, if he made an honest mistake, so be it. But I think it was sort of the beginning of the end. And then, people, I literally, my cardiologist had a patient come into the office and he said, I want to strongly encourage you to get vaccinated, the elderly couple with multiple comorbidities. And guess what he heard from that patient? It's 2 words. Exactly. You just basically dropped an F-bomb on him. And the cardiologist said, I think it's time for you to get a new doctor, which he's allowed to do. Give him a list of other people to go to and move on. But that's the kind of vitriol that it created. And the number of death threats on Tony Fauci and his family, unbelievable. Did other countries use a different approach with NPI and get different results? Like, I'll give you a hint: China, Australia, North Korea, South Korea, more South Korea, Taiwan. What were the results there? Anybody remember during the course of the past 3 years?
Well, I remember in I think it was Australia and New Zealand that they basically just quarantined right away and everyone listened and then they had no COVID. And then when it
It works.
popped up again, it they did the same thing right away and again, it like worked.
Yeah.
People were listening.
So yeah, no, when you get people who don't say you're infringing on my civil rights, it actually works. Ultimately, China failed. China, while we had 1 million deaths, had somewhere between 5 and 10,000. They abandoned their zero COVID policy within the past 4 or 5 months, and about 1 million people died because it was just not sustainable. There were so many new variants and stuff. But it works if you can do it. The problem is it doesn't work effectively as a long-term solution unless you have excellent vaccines and you can develop herd immunity. And what's made it so hard for us to succeed with vaccination, because we've gotten hundreds of millions of people vaccinated. Can we get to herd immunity? If I told you 99% of the population is immune from the first iteration of COVID-19, why would that still fail?
The different variants.
Yeah, the variants have been a nightmare. And there's just really no way to to prevent variants from happening, so once you start having variants and your original vaccine doesn't work, then you've gone from 99% vaccination and immunity from the original COVID, but the ability to be immune from the variants down the road doesn't work. So it's sort of like influenza. We get all these vaccinations every year. They do their best guess as to which vaccine is going to work, but it's an ongoing process. So time will tell. So that answers internationally what different approaches to mitigate the pandemic happened, and we already talked about that as well. Public adoption of social distancing and vaccination, we talked about it. What are the NPIs? Oh, let's talk about testing briefly. Is testing important or not important? What is it good for? What is it not good for? And what should you test for? Or do we not need testing at all? And what are you testing? What are you testing? Are you testing people? Are you testing wastewater? And what are you testing for? What's the outcome you're trying to prevent?
I think I think testing is important because they're testing the wastewater in New York. I don't know if recently, but there's polio in New York. Last semester, I remember reading about it, and then just testing people like for when they give blood and stuff like that, to know what they may have and make a transfer over, or even just for COVID at school. Or
Yeah, no, absolutely. So there've been various strategies with testing, some of which have been successful, some of which have not been successful. Testing wastewater is just a great way to monitor those communities that have public septic systems as to whether there are new variants out there, and whether we're on the uptick or downtick. A lot of people were testing people for antibodies, but we've already talked about the fact that 20 to 30% of people are asymptomatic. What would be more important? What would be a better measure in terms of testing, or what data would you track to see how effective or what the rate of spread is, and how effective in the control in various communities is? Is it whether you have antibodies, or is there a more important outcome? What's the one thing you want to decrease with any kind of infectious agent?
Incidents.
Yeah, so incidence, so morbidity and mortality, both. So how often it happens, and then as the ultimate endpoint, morbidity, are you hospitalized? Mortality, do you die? The reason that only 1 million, how many people, if China had the same mortality rate that the United States had for all the different variants that have occurred, how many people? We've had 1.1 million people die in the United States. How many people should have died in China? Because they had 1 million people die. So did they do just as badly as we did? Not really. They have 3 times our population. So they waited long enough, so they probably saved 2 million lives. So the variants that are coming out now are much less lethal than the variants that the earliest variant. That's really a coup. So, and now they're saying that as compared to influenza, it's probably 5 to 10 times more lethal. But, you know, if it gets down to the level of influenza, then influenza typically causes somewhere between 20 to 60,000 deaths a year. So that would be a whole lot better than 1.1 million over 3 years. So there's a lot there. And again, so testing is important, but you have to choose who you're testing, what you're testing, and what you're testing for as in terms of outcomes. Now, we talked a little bit about contact tracing last week, and so maybe somebody can remember what we said. Why was contact tracing, for the most part, unsuccessful in containing disease? And I think I mentioned my daughter did contact tracing for the state of Massachusetts for a while. Well, can anybody name a disease where contact tracing is helpful and very useful?
Ebola.
Yeah, so contact tracing is really important in Ebola because it's got an 80%, most of the variants are like an 80% mortality. And I think if it wasn't such a small mortality, then people wouldn't have had the attitude I think they did about masks and social distancing and NPIs. So yeah, you know, but contact tracing is crucial there. And then all those people get isolated who have the disease. And then if you're exposed to the disease, they're immediately put into quarantine. So that is critically important. And, you know, we haven't, thank God, to date, we haven't had a pandemic with a highly lethal disease, even though, take my word for it, COVID-19 has been bad enough. But when you have a disease that literally has an R naught, meaning how infectious it is, that's very, very high, again, unless you're using phone apps, it's almost impossible, and proximity things, it's almost impossible to keep track. I mean, China, when they were doing it in the most severe form, literally locked families in their homes. They couldn't leave the building. And then the minute somebody got infected, that person was removed from the home and put into a facility with other infected people. I mean, they literally just grabbed the person wearing hazmat suits and took them to another. And then the people who were in the home were then doubly told not to do anything, not to go anywhere. And if any of them developed symptoms, they too were then removed and put into these facilities which were essentially locked down, effectively prisons. So that's that. Why don't we take a 7-minute break and we can start up again at 1 p.m. And I've got a couple other questions that I wrote up to just get your sense of after the break. So we'll probably get done a few minutes early today. I just wrote some additional questions that I'd love to get your input on COVID. Was the whole COVID pandemic overblown? Was this much ado about nothing? There was an entire Congress of quote unquote experts who said, I can't remember the name of it. It was the something convention somewhere in Connecticut, associated with a bunch of pretty well-known, public health figures, who said that maybe somebody can Google it. But basically it said that we should let young people, everybody other than the most vulnerable, immunocompromised and the elderly, get the disease and get to herd immunity. And Barrington, the Great Barrington Conference, or something to that effect, Great Barrington, you guys can Google it if you want, that basically said, a bunch of experts said, we should just protect the most vulnerable, the elderly and the immunocompromised, and everybody else, including kids, should just get the disease. Does that make a lot of sense? Is that principled? These are all really well-known experts. So I don't want you to think this was like some, libertarian ultra-nationalist. These were, people with reputable careers who came to that conclusion.
Well, like personally, I like think that wouldn't make any sense because what if you live in a household with someone who's immunocompromised or you live with elderly?
And that's the exact point. It is such a stupid thing to say. Sorry to be forceful on this, but that is just a sheerly ridiculous premise because there's this premise that you can protect the elderly and the immunocompromised by like they live in a different world. Oh, we'll just go to that state where they're all located and protect them, and the rest of the world will go on with their lives. The fact is that do kids visit their grandparents? You know, I mean, it's just sheer lunacy to suggest that that was a palpable, reasonable solution. But these are literally people who I think are brilliant, great researchers, great minds, graduates of high-level institutions who don't have an iota of common sense. I mean, it just makes no sense to suggest that as a successful, compassionate strategy. So I went into a locksmith during the pandemic, and the guy had a MAGA hat on and just basically said, you know, if old people die, they got to die of something. You know, it is what it is. Survival of the fittest. Is that prudent or reasonable public health measure?
No, not. I mean, like we know like the definition, or we know that similar definition to like the CDC of public health is to protect all people, regardless. There's no age, there isn't anything that separates one population from another. We're supposed to protect everyone. Doesn't matter. I don't think so. I think it's unreasonable.
Yeah, I think it's unreasonable and unprincipled, but you know, reasonable minds would disagree. They're just like, well, who cares if 92-year-old people die? I do, especially if they're my mother. My mother just turned 92 days ago. But I think it's the measure, how you measure the worth of a society. And one of my mentors, George Annis, who I met in medical school, and then I subsequently, over the past 30 years, have taught on and off with him in courses just like this. He said the measure of a society is how well they take care of their most vulnerable. And I think that's absolutely a true statement. We should be protecting the most vulnerable in our society, and that is how we should measure our success as a society. And, you know, you have to believe in the social contract. You know, there's other people who just want to build a fence around themselves and live in their own cocoon, and you know, they're entitled to their own opinion. But, you know, as long as it doesn't, you know, the freedom to swing your fist ends where my chin comes in. So, you know, that's I think a compassionate view that Professor Annis suggested, and I think in a modern setting with a social compact and, you know, abundant resources, we should do that. I was on social media. I've gotten off since, just because on LinkedIn saying, you know, we can mitigate economic harm, because we kept hearing about this horrible economic harm and economic harm and economic harm. I said, we can mitigate economic harm. We cannot resurrect the dead. So I just think that is a minority opinion and a misguided opinion, but that's just, you know, my thought on it. Other people disagree. So three different items that I want to discuss, and then we'll wrap up. The discussions of education and the profoundly negative impact that the lockdown or semi-lockdown had on education and kids. The second topic, and you can think about these or Google them, the importance of medical misinformation and what should be done about it during the course of the pandemic. And lastly, what's been in the press very hotly recently is the origin of the virus and whether finding the origin of the virus is significant. So let's talk about the educational. What were the spectrum of opinions on what shutting down schools and what kind of impact that had on kids?
Well, I have a 7-year-old and he wasn't in school when schools shut down, so I can't speak to the experienced parents that had kids at that time. But as far as what I've seen for kids coming into school in 2020 and after, it seems like their social emotional learning is behind. I mean, their general classroom learning may be behind, but I think the most important thing is just that a lot of kids were so isolated in this that they're not really sure how to act around other kids.
So yeah, there's educational ramifications of shutting down schools. There's socialization aspects of shutting down schools. And there was a vehement debate, some saying this was devastating and we've destroyed a generation of children because they didn't go to school for 2 years. Interestingly, there were subgroups, as a matter of fact, where, again, I've read that there were subgroups that actually benefited from remote learning, were more effectively taught with remote learning. And in particular, some disabled kids and some autistic kids actually did better with remote learning. So, so people, raise your hand if you think that it really had a huge detrimental impact to shut down schools. So at least a couple of people, and I think there's very strong argument that it had a detrimental impact. Is anybody aware of any literature to suggest that homeschooling is a bad thing? Because parents take their kids out of school all the time and say, I'm homeschooling my kids, which is completely within their right. Should homeschooling be illegal? So there are parents who are completely incapable of doing phenomenal homeschooling, and I'm sure their kids get a terrific education, and I'm sure there are parents who are not good at homeschooling, and they probably don't get a terrific education. But as a general principle, I'm sure there are kids who were homeschooled by their parents during the shutdown and did better. They got more individual one-on-one, attention. And, they could bond with their parents. And I think, so instead of dad or mom going to work, they were able to interact on a very regular basis with their kids and teach. I think that's a great thing. I think every parent should take a week off and if they can, and dads or moms, and spend a week intensely interacting with or frankly, if you've got, like, I was raised by a lot of my childhood, I was raised by my grandparents, and I think just the extended family interacting is oftentimes viewed as a blessing. So I think you can make arguments easily in both directions. Latest stuff I was reading was that objective test scores were down. And there's whole debates about objective test scores and do they have impact in terms of long term. So anyway, I just thought I'd bring that up because it was a very hotly contested issue. So medical misinformation with COVID, issue, not an issue? What do you think of it?
Big issue.
Why? Please expand on that. And just let me check the chat to see if anybody's raising their hands. No, I don't see anything, so we're good. Please.
Big issue because I mean it's like the root to a lot of distrust. Is that a word? Untrust?
Yeah. Distrust, yeah.
Distrust is like it's the root to a lot of distrust in many populations, many communities. I don't know. I know, like, being Black is a big part of my identity, obviously, and so like I saw how my community, and like even like there's reason, like we have a lot of reasons to not trust the medical community and not trust researchers, like a lot of reasons. And so
anybody say Tuskegee?
Yeah. So like
it's embarrassing.
It's ridiculous. And so while we have reason to believe to not put our hope into the agencies and organizations that are built to help us, we also, like, I don't know, it's almost like a cycle that keeps getting rebirthed into America. And like COVID-19, like we saw a lot of people, not even just the Black community, did not trust what was being said. And so that, like, not knowing what the truth is just promotes that more, just promotes the miseducation and people not knowing who to believe, and that just obviously doesn't promote health. So yeah, that's just it.
Do you think there should be consequences for medical disinformation, misinformation? Cindy's
think
nodding. Yeah, I think so too, Amisa. Cindy's nodding. Why? What kind of consequences?
negligent.
Civil, criminal? Yeah, no, that's why I said criminal, civil, negligence
I
is
guess
civil,
like
absolutely.
malpractice.
Malpractice, civil again, absolutely. So I'm going to mention somebody, you may have heard of him. His name's Donald Trump. He wanted, when he was running for office, did he tell people who were going to his rallies to wear masks? No, he didn't. He told them specifically, you don't have to wear masks at my rallies. Did he have people every 3 seats, 6 feet away from each other? Did they say, no, sit next to each other, cheer and scream all you want and don't wear masks? Because that's exactly what he said.
Didn't he like also say drink bleach or something? And
Yeah, he said you should look at the video. And you should see the expression on Fauci's face when he said, well, you know, the way bleach works, like, isn't there any way we can inject bleach? So just scary stuff, completely scary stuff. And he recommended various remedies in public domain that ended up killing people because they did them and they died because of it. So they did a study of how many people died due to his rallies where there was no masking and no social distancing. So people can guess how many people died. So you can just raise your hand when you get to the number you want. 10, 20, 50, 100, 200, 500, 1,000. They modeled it. 600 people died. They just modeled it and they just said how many people went to rallies, how many people died. Were those preventable deaths?
Probably.
He could have had all his rallies on Zoom. He didn't have to have in-person rallies. He could have had rallies where people were spaced out. He could have had rallies where people wore masks. Wasn't it Herbert Kane who ran for office, who was a presidential candidate? Isn't that his name? Kane, Herbert, Howard Herbert. Anyway, somebody can Google it while I'm that blabbering. But he had metastatic cancer. He went to one of the rallies and died shortly thereafter. I mean, it's just the saddest exercise of social Darwinism. When people listen to complete disinformation, they follow this disinformation and they literally die because of it. So disinformation is a disaster. Why can't we typically prosecute people either civilly or criminally for disinformation? Why couldn't if this weren't, let's just say it was a presidential candidate who was not the president, so it doesn't have presidential immunity because presidents can't be prosecuted only through impeachment. But let's say it was a separate person who did this. Why would it be difficult to hold them accountable for killing hundreds of people?
Wouldn't they just use freedom of speech like to get out of it? And I found that the guy was Herman Cain.
Herman, thank you. I appreciate it. So this just makes it better for everybody. So when my brain doesn't work, you're Googling and your brains work. So thank you. I appreciate it, Kylie. But yeah, so he literally died because he went to this rally. It was, and the timing was perfect that he contracted it when he went to the rally and then died in an ICU 10 days later or something. It was really sad. I mean, he had metastatic cancer, which is a tragic disease, but he wouldn't have died in 10 days had he not gotten COVID. So yeah, so it's free speech. So are you allowed to, is hate speech allowed under the First Amendment? You're not going to like the answer to this. Can you say you're a blanking, effing, fill in every horrible word you can think of, begins with a K?
You can say whatever.
I'm
It
sorry?
doesn't, you can say whatever. It doesn't, it's wrong, but you can. Like, no one gets penalized for it. Like, there's a lot of things that shouldn't be said, but no one's getting in trouble for it.
Yeah, I don't know if you guys remember, there's no way you remember it, you weren't even born, but the ACLU originally defended the Ku Klux Klan's right to walk around with swastikas and hoods in, I believe it was Ohio. And they lost a lot of support. They lost a ton of support. Under this statement that this is free speech, people are allowed to have dissenting opinions. And Justice Brandeis from the early 1900s said, you know, free speech is necessary because there's nothing better than as a disinfectant than the sun to shine upon views that are outrageous and anathema. So we should let those views out so that they should be whole cloth rejected. I was on Twitter, I think yesterday or the day before, and there was just a rant of rabbis and various Orthodox Jews that you could tell just by their appearance that they were Orthodox Jews. And these people just ranting completely vile anti-Semitic comments toward them. I mean, horrible, on Twitter, all over the place. Should that be protected speech?
I always heard it when we were like taking like social media literacy classes and stuff like that, is, you know, you have the freedom of speech, but you're not protected from the consequences of your speech. So if you're going to post something online, sure, you can, but does that mean the next job you apply for has to hire you? Of course not.
Anybody a fan of Dilbert? The cartoon? So the guy who writes it, it's a syndicated cartoon across the country, went on a rant against blacks and said all blacks are racist against whites, and he's just been completely vilified for outrageous racist comments. And he's literally lost all his business. Of course, Elon Musk, to his amazing credit, not supported the guy. So really sad, just sad statement about Elon Musk, sad statement about the cartoonist who does Dilbert. You know, I just, it's beyond shocking, but you know, Keisha's right. He's suffering the consequences of his speech. But the truth of it is, under Brandenburg and all the precedents before, under First Amendment, you're allowed to say the most vile, contemptible, racist, sexist, anti-religious comments. And unless it causes an imminent risk of like riot or harm, and I think, honestly, I think that whole body of law, especially now that we have social media, needs to be revisited. If it's foreseeable that if it's outrageous, you know, beyond a reasonable doubt, so criminal level of proof, outrageous speech, and it's completely predictable that it could lead to death and or catastrophic human injury, I think we need to rein that in. I think we need to sort of say the First Amendment doesn't cover that kind of stuff. You know, for instance, the behavior that I described earlier of people trying to incense the Jews that they were taunting, and you know, racial epithets and religious epithets, and just beyond disgusting. So and if we don't imprison them, we should at least civilly fine them. The punishment should fit the crime. But you know, clearly it has to be something beyond just it. The only thing you can't say is something that incites a riot, like, you know, the movie theaters on fire, and there's you know, and there's a stampede to the door and 10 people die. So you're not allowed to say that. You're not allowed, but I mean, you could really argue, if you look at the words from the January 6th speeches prior to the invasion of the Capitol, you know, we need to fight like hell. I mean, it was pretty outrageous, and nobody's been held accountable for it. Anybody else who wants to chat about that or has a thought? Not
I
the-
just know like Twitter's been blowing people like Trump, and I think Kanye is for like their comments like that because Trump was like it was inciting violence or whatever. So, like,
So they
some-
originally did that, but now that Elon Musk spent 40 billion, he's allowed everybody to come in and say whatever they want.
I
He's
haven't
fired
seen,
three-quarters of the people who work for
yeah,
Twitter.
I've seen, I don't know, I haven't seen Kanye on anything for a while though, but he said some pretty messed up things.
Oh my goodness gracious! Open mouth, insert foot. Yeah,
But it's a lot of celebrities.
Yeah, I know. I actually just posted on Twitter saying, what is it about celebrities that somehow their opinions are more valuable than your opinion or my opinion? Just because you can act on a screen doesn't make you an expert on social justice or public policy issues. I mean, I always find it just shocking, just because somebody wants to hear you sing doesn't mean that I need to listen to your political rants. I mean, it is really scary. So
Right. I agree, Nick. And so, and like that article, sorry to cut you off, but the
no,
article
please do.
the article you had us read about like lessons learned from the COVID-19 outbreak, it like they had mentioned like holding government officials responsible for their like uncommitment or uncommitment. Why am I not? I don't know the opposite of these words, but like not committing to protecting the health of others. And so, I mean, I feel like to your point about celebrities, like even just people who have like so high social rapport and like who are held like very highly in their societies should be held responsible. Like, okay, without like we're not gonna like trying to arrest every user on Twitter who said something like outrageous is just unrealistic and almost it's just not feasible. And so, but like people who are held very highly in their societies should be held responsible for the action. They have like crazy influence on groups of people ranging from interest groups like guns, and they just range to there's a wide variety that of people who should be held responsible for what they say online.
And you don't have to arrest them. Holding somebody responsible may just be you're removed from Twitter, you're removed from social media. It might be massive fines, Yeah. You want to say those kinds, you want to make those kinds of, I mean, just look at all the sports organizations, NFL, NBA, et cetera, where somebody makes an outrageous or ridiculous comment, they're fined, hugely fined. So there's both public sector and private sector areas where people can be held accountable. So yeah, I couldn't agree with you more. And I think we need to rein in free speech. There has to be some level of an outrageous conduct that is foreseeably going to cause death, short of imminent harm and inciting a riot that people could, because it was completely predictable that what Trump was recommending was going to kill people, and it did. So if he weren't the president, I would hope that there was some way of holding him accountable. Now, does it need to be in jail? I'll let people argue that one way or the other. Should he be fined? Is his behavior beyond contempt? Yeah, it is. But, some level of accountability. I mean, certainly the reason we make drunk driving a criminal offense is because it's absolutely predictable that you're going to kill people if you get in a car after you've been drinking alcohol and get into an accident. So I just don't view this as any different at all than drunk driving, when it's absolutely clearly foreseeable that you can cause death or permanent harm. Last but not least, tons of recent press on the significance of the origin of the virus. Is that a who cares? So one of the government, and I can't remember, you guys can look it up, but one of the government, so the government's all over the place. There's like 12 different departments, half of which say we don't know, a third of which say, natural distribution of the virus. And then this newest one that said with low confidence, it came out of the lab. So is it important, not important? Why is it getting so much press? Who thinks it's important? Let me know why, tell me.
Well, I feel like in some ways it could be important, and like I guess like seeing how the disease started so they can like prevent others, but like I can see both sides of it.
Yeah, no, you know what, this course is about prevention, that's why I asked the question. So yeah, I agree with you. If it came from the lab, what would be our upstream mechanisms to prevent this from happening again? It's not directed at you, Amy, anybody can answer.
Would you want like more restrictions in the lab? Like,
Yeah,
I don't
just
know.
lab safety, absolutely,
Yeah.
Kylie, absolutely, just lab safety. So let's just make sure if this was indeed a lab leak, that we redouble, and just so you know, BU has like the highest level of, they have like the most horrible viruses known to man, and they have the highest level of security and safeguards in it. It's literally almost in downtown Boston, it's off Com Ave. I went to BU, that's why I know this, but they have one of these super high risk labs, and in Washington DC they have these high risk labs where they have the most lethal viruses known to man. And so lab safety, and what if it was a natural phenomenon? Does that, what would you do in that situation? Because a lot of these, yeah, by all means, Kylie, sorry.
I feel like you just learn when it just like happens. Like with polio, they like had to like just go with it, learn, make a vaccine and get through it. It's kind of what happened with COVID. We don't really know where it came from. People like have all those crazy beliefs though. Like it was really pissing me off when people were saying it came from like China and from all the bat stuff. Cause like I would go to the beach after like COVID and like they were still like, I saw like teenage boys coughing at like people who they thought were from China. And I'm just like, this is like literally so racist. Like I like they not even be from like China at all. Like you just don't know. And it's just like, I don't know, it was brutal. And that's one thing that really like irks me is when they start blaming like other countries. Like if it happened, it's bound to happen. Like people make mistakes and some of them are pretty bad mistakes, but if it came from like a lab in another country too, like you just, I don't know.
Live and learn. Yeah, I agree with you.
That's
Yeah.
all we can do.
Yeah, and there's been a lot of sort of pointing of fingers at the open markets, because I think the open markets in Asian countries, in particular China, have been real, because they, you know, they allow really like you can, I think you can buy bats or buy all sorts of animals that are not considered part of a typical diet, and that's been implicated as a potential source for spreading of disease, especially you know, flu viruses and the like. So I mean, again, if they can do something about open markets, if it's shown that that open markets are sources of disease and contagion, then we should do something about that, and China should do something about that, or whatever countries, whether it be Thailand, China, India, or some, you know, exotic food market in you know, Belgium, whatever it is. If we can show that those are potential vectors and sources for epidemics and pandemics, we should do something about it. That's about it for me. Anybody else have any topics, either through chat or raising your hand? If I look to to my right, it's because I'm looking to see if I missed anything on chat or on the participants list.
I don't want to keep talking, but I saw something about bird flu coming back, and there's like a rare mutation that's someone's daughter may have passed it to the dad, and that's like a really rare thing to happen, I guess. But we can probably talk about like next class if you want, but it was something
Yeah, no, I think it's a great topic, and I just don't want to drag this on because
Yeah.
I'd love to get you out of here 5 minutes early, but I think it's a great topic. I've been reading about it as well, and the verdict's not in, so maybe we'll have in the next 48 hours a little bit more information to talk about it. So I'll put it on the agenda for next class as well. I will give you a heads up that next Thursday I've made an appointment for myself personally 6 months earlier, so I'm happy to reschedule class or just cancel it, whatever your preference. So, well, how about show of hands? I mean, if I cancel class, it's just more time for you guys to work on your paper. If you like chatting about all these cool topics and exploring them, then we can reschedule. It's all good. Whatever your preference is. If you need the extra time, give me a hand raise if you would just as soon have a class. And we can have a class just with whoever's interested. So it's not a required class, but we can just have a class where people who are interested in talking about current topics can join, whether it's 2, 3, 4 people. So whatever, I'll leave that to you guys to decide. And other than that, stay healthy, be well. And again, I'm available all the time to help with papers, questions, and do check your past due assignments so that, you know, you get some credit or all credit for your passing in the assignment, as opposed to 0 credit, because it's always hard when you get 0 credit to, even if you get all 100s, one assignment not passed in that scores a 0 is not good for the average, really does bad things to the average. So please do that for your own benefit. If any one of you individually wants me to tell you what I haven't gotten from you, I'm happy to do that as well. Great.
Can I still resubmit?
Yeah, you can resubmit all the time.
Okay.
If you got an 85 and you want a
Yeah.
95 or 100, resubmit.
That's
You got a
that's just me.
95 and you want to get 100, and I try to put comments on all these. You know, if you want to know why you got 95 not 100, and I said very good instead of excellent, yeah, I'm happy to tell you what was missing that you got docked. It always falls on deaf ears to me. When you got a 95, that's an A. So, you know,
Yeah.
if you really want a
I
100.
I want to fix my like 80 and 90s kind of. Just
Yeah,
'cause
yeah,
I
no,
want
absolutely.
more
By all
points.
means, yeah. Just
Yeah.
email me when you resubmit, just so I know
Yeah.
to regrade. And everybody can resubmit till you get 100. It's all good.
Thank you.
Thank you.
Take
Have
care.
a good day.
See you in a couple days.